Good morning, Chairperson, guests, and colleagues. I'm Wenyi from NT West Cluster. Thank you for giving me the chance to share the design and experience towards our new service model adopted since year of 2023 for those patients who are suffering from hematuria. The hematuria belongs to one of the indicators for urinary tract malignancy, particularly the bladder cancer. Its presentation similar with those benign urological disease such as UTI or urinary stone. The integrated model of SOP service was being adopted into hematuria nurse assessment clinic, and hereafter refers to HNAC since December year of 2023. The HNAC was designed aimed at reducing unplanned hospital visit together with the episode of medical consultation by carrying out series of investigation or nursing intervention led by qualified urology nurses with the guidance of pre-approved protocols, and to report the clinical outcome of HNAC service among the 564 patients. The HNAC also aimed at effectively prioritize patients who suffering from hematuria. The immediate treatment or advices can be carried out by early detection of urological emergency or malignancy during the triage process, preventing complication aroused secondary to unplanned hospitalization or undergoing emergency operations. Traditionally, patients presenting with hematuria will arrange a medical consultation at ambulatory care center and hereafter refers to ACC for assessment within 1 to 3 months. A comprehensive hematuria workup with extensive waiting times for outpatient appointment and a lengthy system of investigating and diagnosing takes another 4 to 6 months to complete. A redesigned HNAC was adopted, facilitating the workup pathway. This is the preset HNAC pathway algorithm. All urology new case referrals were screened by urologists at ACC. Patients presenting with hematuria were referred to HNAC, which are located at both Two Moon Hospital and Port Hospital Urology Day Center for initial assessment before attending their first medical consultation. The attendance will be arranged for carrying out a comprehensive clinical history taking, investigation, and related interventions. All investigation reports will then gather and pass to urologists for final screening. The medical appointment will then be granted accordingly. A retrospective two-center, Two Moon and Port Hospital, review of 564 patients with hematuria managed by HNAC between December 2023 to November 2024 were included for analysis from our local database. In November 2024, patients were invited to participate in the questionnaire over 1 month to evaluate patient experience and their satisfaction level towards the HNAC. The questionnaire was designed to assess patient satisfaction in various dimensions, includes self-empowerment enhancement, interaction with nurses, and its waiting time. Within the population, we have 324 male and 240 female with mean age 64.56 years old, range from 14 to 93 years old. The average waiting time for initial assessment was around 16 days. 74% of the population reported painless hematuria, and the rest of them experienced painful hematuria. 18% of the population were found to have abnormal ultrasound screening with suspicious of 18 bladder mass, 12 bladder stone, 45 renal stone, and 29 hydronephrosis. Among the 18 suspicious of bladder mass from the ultrasound, half of them confirmed bladder malignancy, and the rest of them diagnosed with 1 enlarged prostate, 1 cystitis, 2 ketamine bladder, 2 normal findings from the flexible cystoscopy, 1 repeated ultrasound by the urologist with normal findings, 1 defaulted their FC, and 1 no FC being offered as medically unfit. For 87 of the population with with positive urine cytology results, while only 9 of them diagnosed bladder cancer. The false positive rate was a bit high, reflecting that the sensitivity of the urine cytology testing towards the urinary tract malignancy is relatively low. 80% of the population follow up at ACC, with 66% of the population undergone FC. 23 of the FC population end up diagnosed malignancy with 17 bladder tumor, 1 RCC, 2 prostatic cancer, 1 ureteric tumor, 1 penile tumor, and 1 cervical tumor. The average waiting time from HNAC to ACC follow-up was 112 days. And the average waiting time from HNAC to FC was 170 days. 40% of the population confirmed malignancy, and 85% of the malignant population can perform FC within 3 months. Patients attending HNAC on November 2024 were invited to participate in the questionnaire with 100% return, and most of the patients were satisfied with the service provided. And the data analysis was limited by data incompleteness, with around 12%, 20% of the population defaulted their follow-up and even the flexible cystoscopy. And their definitive diagnosis and the pathology results remain unknown. And based on the above analysis, the redesigned HNAC led by urology nurses demonstrate essential roles facilitating patient journey and effectively prioritize patients who are suffering from hematuria. The immediate treatment or health advices can be delivered, facilitating early detection of urological emergency or malignancy, preventing complication aroused secondary to unplanned hospitalization or the operations. And this is the end of my presentation. Thank you.